Imagine the year is 1862. You've been suffering from a dreadful cough for some time now, so you seek out the help of your local physician, who recommends a course of treatment that will really get rid of this cough once and for all: bloodletting and leeches. Your body is covered in leeches, and as you bleed out, you realize that you have made a terrible mistake. This may sound like an over-the-top horror movie scenario, but this was actually a common sight during the Middle Ages. The practice of removing blood from the body to treat illness or injury dates back thousands of years. There were many different methods of bloodletting, each with its own risks and complications. Well, it's because of the way that medicine was practiced during the Middle Ages. During the Middle Ages, medicine was not based on scientific evidence or reason, but rather on tradition, superstition, and religious beliefs. This made them appealing to both experienced physicians and to unqualified practitioners such as barbers and midwives, but they were necessary in order to cure the illness. During the Middle Ages, religion played a major role in people's lives, and it also had a major influence on the practice of medicine. This brings us to the beginning of our story. Imagine that you are a sick person in the early 19th century, suffering from an illness that you believe can be cured by bloodletting and leeches. You visit your local physician. In the 19th century, the germ theory of disease was developed and proved that illnesses were caused by bacteria and other microorganisms. From the Black Death to the rise of modern medicine, these treatments were used for centuries to try and cure all sorts of ailments. But as we've seen, they often did more harm than good. What do you think? Would you ever try bloodletting or leeching? Let me know in the comments below. And don't forget to subscribe for more historical tales. Thanks for watching. This discovery eventually led to the use of antiseptics and anesthetics, which made bloodletting and leeching unnecessary. Today, these treatments are no longer used and are considered to be relics of a bygone era. However, they remain fascinating examples of the evolution of medical practice and the lengths to which people will go in order to cure illness and injury. Who inserts a sharp needle into your jugular vein and begins draining your blood? As you feel weak and nauseous, leeches are applied to your body, and they begin sucking your blood. Finally, as your body is drained of blood and the leeches are removed, you realize that you may have made a terrible mistake. Many religious figures, including priests and monks, were also healers, and they often used bloodletting and leeching as treatments. It was not uncommon for patients to undergo multiple bloodletting sessions and to have dozens of leeches applied to their body. The main reason for this was that these treatments were seen as necessary evils. That is, they were unpleasant and sometimes dangerous, but they were necessary in order to cure the illness or injury. For example, during the Middle Ages, bloodletting was often used to treat the plague, a deadly disease that killed millions of people. While the treatment was obviously unpleasant and dangerous, it was seen as necessary in order to cure the disease and save the patient's life. Similarly, leeching was also seen as a necessary evil in order to cure other illnesses and injuries. The amount of blood that was removed during a bloodletting session could be significant, and the leeches could suck up large quantities of blood as well. In some cases, this could lead to death. There were also risks associated with the use of leeches. Leeches can carry bacteria and other microorganisms that can cause infection. Additionally, the insertion of the leech into the skin could cause pain, irritation, and even bleeding. In addition, these treatments were sometimes seen as a way to punish the body for sins or to atone for them. For example, during the Middle Ages, some people believed that illnesses were caused by sin, and that bloodletting and leeching were a way to cleanse the body and atone for the sins. This belief led to the use of these treatments not only for illnesses, but also for other purposes such as during childbirth or before a person died. This belief was based on the idea that illness was caused by an imbalance in the body, and that restoring balance required some unpleasant treatments. For example, during the Middle Ages, bloodletting was often used to treat the plague, a deadly disease that killed millions of people. While the treatment was obviously unpleasant, it was seen as necessary in order to cure the disease and save the patient's life. Similarly, leeching was also seen as a necessary evil in order to cure other illnesses and injuries. As we mentioned earlier, during the Middle Ages, medicine was not highly regulated, and anyone could set themselves up as a doctor. This led to a proliferation of unqualified practitioners who performed bloodletting and leeching without proper training or hygiene. This, of course, led to many complications and deaths, but it also contributed to the popularity of these treatments. Doctors were often not educated in the scientific method, and they relied on old wives' tales and folk remedies. This led to the use of many ineffective and even harmful treatments. such as bloodletting and leeching. Despite the fact that they were used for centuries, these practices were never proven to be effective. In fact, they were often harmful and sometimes even deadly. Removing blood from the body can cause weakness and even death, and using leeches can introduce bacteria into the bloodstream. Despite the risks, bloodletting and leeching remained popular throughout the Middle Ages. One of the most common methods was scarification. The first reason why bloodletting and leeching were so popular was because they were thought to be effective treatments for a wide range of illnesses. As we mentioned earlier, medieval doctors believed that all illnesses were caused by an imbalance of the four humors, and they believed that by removing blood, they could help to balance the body and cure the illness. This belief was based on ancient Greek and Roman theories, and it persisted throughout the Middle Ages. In fact, it was not until the 19th century that the germ theory of disease was developed, and proved that illnesses were caused by bacteria and other microorganisms. This discovery eventually led to the decline of bloodletting and leeching as medical treatments, but until then, they remained popular, which involved cutting small incisions in the skin and letting the blood flow out. Another method was cupping, in which a cup was placed over the skin and the air was sucked out, causing the blood to rise to the surface and be collected. Bloodletting was also sometimes performed using leeches. Leeches are a type of segmented worm that has been used for medicinal purposes for centuries. They can grow to be quite long, reaching up to 10 inches in length, and they have the ability to suck blood. Leeches were often used in conjunction with bloodletting and would be applied to the area where the blood was being drawn. They would then drink the blood directly from the wound, which not only helped to stop the bleeding, but was also thought to draw out any impurities. In ancient Egypt, Greece, and Rome, it was used to treat everything from headaches to more serious conditions, like epilepsy. During the Middle Ages, the practice continued to be popular and spread throughout Europe and the Middle East. Bloodletting was based on the belief that the human body was full of four humors: phlegm, black and yellow bile, and blood, and that illnesses were caused by an imbalance of these humors. By removing blood, either through bleeding or leeching, the body could be rebalanced and the illness cured. Doctors often used these two unsavory methods to cure all sorts of ailments, from head colds to more serious conditions like the plague. But how did these practices start, and why did they go on for so long? Well, let's find out in today's episode of The Horrors of Medieval Things. So there you are in the late 19th century, sitting on a chair, while a doctor inserts a sharp needle into your jugular vein. We are back with another installment of the Horrors of Medieval Things series, where we explore the many bizarre and gruesome aspects of life during the Middle Ages. If you haven't already, be sure to check out our other videos on the subject. We cover everything from disgusting food to terrifying medical procedures and beyond. And if you enjoy it, please be sure to subscribe so you don't miss any new installments. Today we are talking about one of the most popular treatments used by medieval physicians, bloodletting and leeches. Let's start with bloodletting. But this wasn't done in just any old way. Now, you might be wondering why these practices were used for such a long time, even when they were clearly dangerous and sometimes deadly. Let's look at why exactly doctors were so fond of them. The second reason was because they were easy to perform. Bloodletting and leeching were relatively easy to do, and they didn't require much skill or training. Another reason for their enduring popularity was that they were seen as a necessary evil. That is, they were unpleasant and sometimes painful to undergo. Finally, bloodletting and leeching were supported by religious beliefs. By the time the 19th century rolled around, these two practices were still very popular, despite mounting evidence that they didn't work and were often harmful. While this scenario may seem extreme and over the top, it was actually a common occurrence during the Middle Ages. However, despite the risks, bloodletting and leeching continued to be used throughout the Middle Ages and into the 19th century. In the end, it was the development of modern medical science that led to the decline of bloodletting and leeching as medical treatments. And there you have it, a look at the horrible world of medieval bloodletting and leeching.